Hold
Hi
on.
there. I'm going to do a heuristic evaluation of the app script. So firstly, we've got the app here, so you click on it and that opens. And the disclaimer comes up and it automatically goes away if you don't click it, but I'm going to click OK, got it. And then we've got two options. We've got adults or children for the antibiotic treatment guideline. So we'll go on to children. And as you can see, the visibility of the system status. So when we first open the app, you can see we've got the labeled children guidelines at the top, and then let's say we click on ear, nose and throat. It stays the same with its layout with ear, nose and throat up the top, and we never have to type anything in it. So you've always got the inputs already written out for you and you select it. The second heuristic is the match between the system and the real world. So the app itself is able to provide information in a way that the user knows and understands. So as doctors are often going to be the primary users of this app, this is the language that corresponds to the users. So it's got, for example, sepsis, ear, nose and throat, respiratory tract, all which a doctor as the user knows what it means. For the severity score of this, I've rated it 2, as there is an option that some of these conditions actually might have more conditions that are often presenting in the emergency department. So if that's the case, then this app would be weak in terms of not having all of the conditions that could possibly present. And this, in order to improve this feature, this would require feedback from the users itself. Another heuristic is user control and freedom. So if I went on to skin and soft tissue, there is a back button. So the app itself has clearly marked exits, which are in the top left corner, and also it has other options for tabs below here, which means you can exit the page as well. So overall, for this heuristic, for user control and freedom, there is a score of 0 because it has clearly marked exits and a great user control and freedom. So now I'm going to go through a test case. So if we go back to the children guidelines and select, what will we select? We will select skin and soft tissue, and then we will go to infected eczema, bacterial infection, and as you can see, as you go through, it asks different questions. So most children should be managed with oral antibiotics unless systemically unwell or very severe. So my child has presented with very severe symptoms, so I'm going to select IV option. Is the patient currently known to have MRSA? I'm going to select no. Does the patient have a history of allergy to penicillin? I'm going to select no. So then, this is the final output for our example case. The first line treatment is flucloxacillin at 25 milligrams per kg at a maximum of 1 gram, and it is going to be administered IV every 6 hours for 1 to 2 days. And then if we go into this review tab, it gives us additional information. So this tells us to review the patient at 24 to 48 hours, and if the patient has improved clinically, consider change to oral antibiotics. And this is what we'll give the patient later. So oral antibiotics in the form of capsules or cephalexin suspension, which is in a liquid form, both orally consumed rather than IV. So in terms of the heuristic of consistency and standards, the app script has kept the same layout as was just demonstrated in the previous case, and follows the conventions throughout the use of the app. So that means it's still got the same layout throughout, and it keeps with the colour scheme for the children guidelines versus the adult guidelines. So it's great. In terms of the fifth heuristic, error prevention, the app script has built-in ways to eliminate errors. It doesn't have many error prevention parts, but if you click on this tab here and go into About, it gives you the antibiotic colour guide. So every time an output is arrived at, it will tell you what colour it will be coloured, and if it's penicillin based, it'll be red, and not penicillin based, green, and yellow or purple if it's either of these other two options. These are error prevention methods because primarily we don't want to give the patient a penicillin based antibiotic unless we are sure that they're not allergic to it. And there's other checks usually throughout the case, but this is the second way that we know if it's penicillin based or not. In terms of the sixth heuristic, called recognition rather than recall, when a user comes to use the app, they don't have to remember much all the time. So what they can do is click on this tab here, which will go into their recent cases. So if they've had a patient with the exact same symptoms and they're thinking, oh, I've got the same patient again, they can just click on it and go through the same process again. However, because as you can see we have to go through the same questions, I have given this a severity score of 1 because it doesn't go straight to the recommendation for treatment. In terms of flexibility and efficiency of use, the user can have two options for quicker outputs. They can either choose this tab to get this screen with each option, or they can click this tab where they get their recent cases. However, again, I've given this a severity score of 1 due to the fact that we cannot go straight to the recommendation straight away from any part of the screen. And the eighth heuristic is the aesthetic and minimalist design. And overall the app has done an amazing job with this, as there is no overcrowding or busyness, and it provides clear and correct information. So as you can see, you can change from the children guidelines to the adult guidelines by hitting change. And now I'm going to demonstrate how this app helps the user to recognize, diagnose and recover from errors. So I've recognized this as there's the 4 different tabs that you can navigate through, and the user can go back at any time. So if they hit ophthalmology, then conjunctivitis, they can always hit the back button. However, as we cannot completely go back to the home page where there's the children and basically there's no homepage return button to go to the very first homepage where we select children or adults. So I think this is an error that needs to be fixed, and I've given it a severity score of 2. The 10th heuristic is help and notification. Script has the 3rd and 4th tab reflecting this heuristic. So this tab here, the user can provide feedback, and then you can select a category. So you can select compliment, wrong result, bug or suggestion, and then send to the relevant app developers. Additionally, there is the information tab here, which tells you about what version the app is, when it was last reviewed, and then the antibiotic colour guide for reference, and then if you need more information, this link. However, I noticed that this link doesn't work, so I've given this a severity score of 1 as it needs to be fixed. And now I'm going to demonstrate a test case. So my patient has come into the emergency department at Auckland Hospital, and they've presented with an eye issue, and I'm pretty sure I know what it is, so I'm going to click on ophthalmology, and it looks something like conjunctivitis. So I'm going to click this, Is mucopurulent discharge present? I'm going to click yes. So, I didn't remember, but these are the treatments required. So, we've got 1 drop of this antibiotic every 4 hours for 7 days, and then 1 application of this antibiotic, which is a higher strength of the previous, at night for 7 days. If I were to select no instead of yes here, no antibiotics are required. So that is one example. And again, if we were to select this one here, post-traumatic penetrating injury of the eye, it tells us to consult with a specialist, and that is out of my scope of my practice. And then if the patient has blepharitis, we are to give the patient a warm compress and cleanse the eyelid margins. And then the treatment is similar to the conjunctivitis treatment, antibiotic. 1 application twice daily for 5 days. So I'm going to go back and demonstrate one child case, which will be in the ear, nose and throat. So this child presents with a sore throat, yes. Risk factors for rheumatic fever. Are they mild and Pacific? Yes. Are they 3 to 35 years of age? Yes. Are they living in crowded circumstances or lower SES? Given they are in Auckland DHB, they have told me what area they live in, so no. Take a throat swab. Is this recurrent? Yes. Are you confident that adherence is adequate? Yes, I am. Does the patient have a history of allergy to penicillin? No, not that I know of. Have they completed a course of amoxicillin without clearance of GAS, which is the virus? No. So this is an amoxicillin plus clavulanic acid, total dose 20 milligrams per kg, orally 3 times daily for 10 days. And this, because it's red, we know that it is penicillin based, and the review tells us what other information we need to know and gives us a link to the Heart Foundation guideline if we need information about rheumatic fever. Whereas if the patient was allergic to penicillin, yes. Can the child swallow capsules? So it asks us these questions. So if we say yes, then it gives us an alternative, clindamycin, which is a purple colour, meaning it doesn't contain penicillin. And again, more review. And if they can't swallow capsules, we need to consult with the paediatric infectious diseases specialist at ADHB. Right, thank you for watching.